Hello, everyone. All right, so this month we've been talking about prediabetes, and we've learned this month we've been talking about prediabetes, and we've learned Okay, let's fix that. So we've learned what it is, and we've also learned how to prevent it, how to reverse it. But today we're going to be dedicating it to those who already have diabetes. Over the years, I've seen many people that have had diabetes, and today I want to share my top 3 tips for people with diabetes. So you're listening to Connecting the Dots with Dr. Ashaye. I'm Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of In Touch Primary Care in Sugarland. It's an innovative medical clinic, and we offer an alternative way to receive healthcare that is stress-free and focused on the patient. So you can find out more about our practice on our website, www.intouchprimarycare.com. And if you're in Texas, you can schedule a free 15-minute consultation while you're on the website. Okay, so we're talking about how diabetes affects the body when prediabetes turns into diabetes. So diabetes is diagnosed by a simple blood test, and usually it's a fasting blood sugar over 126 or a random blood sugar over 180, or you can have an A1C of 6.5 or more. So those are the ways that we diagnose diabetes. And what happens is it's a combination of genetics and environmental things and lifestyle. So for the various reasons, a person can develop diabetes. And sometimes people will develop prediabetes first. Sometimes they wouldn't, they would just, be diagnosed with diabetes right away. But either way, I've talked about how it's a result of the increasing insulin resistance, declining ability of the cells in the pancreas that produce insulin to actually produce enough insulin to take care of the sugar that we are ingesting. And we've talked about the fact that the cells in the pancreas, the beta cells, they die from long-term exposure to insulin. So the higher the blood sugar is over time, the worse the cells are affected, and it's like a cycle. So the good news, though, is if it's addressed early enough, we can often reverse, diabetes or prediabetes. So especially if it's addressed early. And that's what we focused on with prediabetes. You can look at the other episodes on how we can reverse that. Okay, so how does diabetes affect the body? So diabetes damages blood vessels. They cause plaque to build up in the vessels, and that makes it difficult for blood to get through to your organs. So we have blood vessels everywhere, right? And so when there is plaque buildup in the vessels and those vessels are damaged, the blood cannot get to where it needs to get to. So small vessels like vessels of the eyes, the kidneys, the feet are affected, but also large vessels like the heart and the brain are also affected. So basically, by damaging the vessels, and also the vessels that take nutrients to the nerves can be affected as well. And that's why people with diabetes may have, neuropathy, which is painful pain in their feet or other small nerves, because those vessels are affected, or numbness. People with diabetes may also have a higher risk of heart disease and strokes, also have a higher risk of eye, kidney, and nerve damage. So people with diabetes may or may not have symptoms, and we talked about this in the past, where sometimes, there are symptoms, and so the person is aware that something is going on. But unfortunately, in some cases, people don't have symptoms until it's really severe, and that's why testing is really, really important to give the greatest chance of reversing diabetes. Testing often, testing consistently, so that we can be sure that there isn't any need for further management. So, but diabetes can make you feel very tired. It can cause many other symptoms. It can cause you to feel like you need to go urinate a lot. It can cause you to feel very thirsty. You can lose weight when you're diabetic, especially when it's severe, when you have really high blood sugar. Your blood sugar, you can start to lose weight without trying, which, for some people, they may think it's a good thing, but actually, if it's damaging your organs, it's not. It can make you feel very hungry. It can make your vision blurry, make you feel numb or tingling in your hands or your feet, can make you have very dry skin, make you get sick easily because your immunity has been weakened, or make it so that when you have a wound, it doesn't heal as easily. So those are some symptoms of diabetes. But like I said, some people will have symptoms, but many times the symptoms happen way later when the blood sugars are high. Sometimes it happens early, but it's important to screen, to test, to make sure. So where does diabetes come from? So as I mentioned earlier, people can develop diabetes, due to a combination of things. It could be genetic, it could be environmental, it could be from, their lifestyle. And when I say environmental, like if their microbiome in their gut is affected, it can predispose them to diabetes. We can't do much about our genetics, but we can do a lot about our lifestyle and our microbiome. And so that's one. I'm going to get into 3 tips for people with diabetes. But before I get into it, this is not, medical advice. Always check with your own doctor. If you do not have a doctor, you're welcome to check us out at In Touch Primary Care. We're here in Sugar Land, and you can reach out to us through our website, www.intouchprimarycare.com. But always check with your doctor. So the first tip I would like to share today that I found to be a top tip for my patients with diabetes is consider continuous glucose monitoring. So some of you that may be familiar with diabetes know that you can check your blood sugar, and that's often something that is encouraged. Some people have to check it more than others, but even if it's mild, where you do not necessarily have severe diabetes, severe high blood sugars, it might still be helpful to just know what the foods are that cause your blood sugars to be high, because it's different for different people. I mean, we know generally speaking carbs, but we eat a variety of things and we cook it a variety of ways. And sometimes what somebody thinks is healthy may not be healthy. And sometimes it's really confusing. So what I found is the easiest way to determine what a good diet for you is continuous glucose monitoring, getting the machine that checks your blood sugar throughout the day easily. Even if you're doing it for a month or 2, it's a good investment. And that way you can figure out, oh, when I eat this, my blood sugar is fine. And when I eat this, my blood sugar is high. I've had people that were, substituting, for example, honey for sugar, thinking that that was a better option for them, and found that the honey raised their blood sugars just as much. So you just need to be careful about, what you're eating, or maybe they're eating a lot more honey than they would have had sugar and thinking that they're being healthy, or eating a ton of fruits and smoothies and thinking that they're being healthy when in fact their blood sugar is actually getting worse. So continuous glucose monitoring can be very helpful for people that have diabetes, just to figure out what is good for them to eat. And then after that, you can determine what to do next. The next tip for people that have diabetes, I will say, is use lifestyle behaviors to lower your blood sugar and to lower medications. So I've talked about this a lot in previous episodes, but if the foundation is not solid in terms of health behaviors, what is going to happen is we're going to need to add more and more and more medications. And a lot of people have seen this happen. And the thing about it is there are some conditions that kind of go hand in hand because how it happens is similar. So for example, I mentioned plaque in the arteries. Plaque in the arteries also happens with high cholesterol, right? And so a lot of people will find that they have diabetes and high cholesterol and high blood pressure because all those things affect your vessels, right? And when you use lifestyle changes as a way to reverse these things, you're reversing all of them. So you get the benefit, like instead of treating just the cholesterol with this medication, just the diabetes with this medication, just the blood pressure with this medication. When you have a lifestyle approach, you're treating all those conditions with one thing, with the lifestyle changes, and everything gets better. So, we know that, for example, studies have shown that people with diabetes on insulin can actually increase their sensitivity to insulin with regular physical activity. So with regular physical activity, the insulin amount that they take decreases. They don't need quite as much insulin. We've shown that people that have healthy sleep, when sleep is healthy, they do better, and their blood sugar is more regulated, and they don't need as much insulin. Their blood sugar is controlled. So things like that. So lifestyle changes can help at any point in time. It's never too late to incorporate it, to lower your medications, or in some cases even eliminate medication. So that's my second tip. Use lifestyle changes regardless of where you are in the stage of diabetes. Long term, it's really, really the way to go. And you can listen to our previous episodes on prediabetes and on diabetes to learn more about lifestyle changes like healthy diet, nutrition, healthy diet, physical activity, sleep, stress reduction, and all that stuff. And then my third and final tip for today is see your doctor at least 2 times a year. Ideally, even more in some cases, may need to see the doctor 4 times a year, but at least 2 times a year, and check your blood sugar. I've seen blood sugars go up and down a lot, and really within a span of a few months, it can make a big difference. And remember, when the blood sugars are high, that's what kills those beta cells, right? And so if you're going 3 or 4 months with high blood sugar, those beta cells that are supposed to help you produce insulin are dying. And that's making diabetes worse in the long run. So it's a big deal not to have, not to know what's going on in those times. So make an effort to follow up with your doctor regularly. Don't take it for granted. So those are the tips I had to share today. I hope that helps. If you have diabetes, or if you know somebody with diabetes, please share this episode with them. It could be something that could make a big difference for them and help them get better quickly. Hope that helps. Have a great day.